Today's For Seniors segment is sponsored by Comfort Keepers.
And today we're talking about staying mobile longer. If you're a baby boomer suffering from knee pain or an old knee injury, you're far from alone. This active generation still wants to go to Zumba class or zoom down the ski slope, and that's leading to some more knee surgeries. Joining me to talk about signs you may need a knee replacement is Dr. Todd Olsen. He's from St. Anthony's Bone and Joint Hospital. Thanks for being with us.
Thank you for having me.
And I understand the need for knee replacement has just skyrocketed between the ages of like 45 to 64. Why?
There's probably three factors that you could look at to better understand those numbers. The first factor is, of course, the baby boomer generation. That age bracket from 45 to 64 is now occupied by the baby boomer generation. And so as the number within that age bracket has grown, so has the need for knee replacement surgery. But the second factor would be trauma to the knee. There's been some very good studies that clearly show that previous injuries to knees can lead to the development of early wear and tear osteoarthritis, and the baby boomer generation has historically and continues to be a very active generation.
Yeah, let's talk about osteoarthritis as compared to overuse. What exactly is that?
Well, the process of wear and tear osteoarthritis is the degeneration and the thinning of the articular cartilage on the end of the bone inside the knee joint. So with overuse, there can be inflammation and strain to the knee, but if the overuse exceeds what the body can naturally repair, then it can advance the wear and tear osteoarthritis process.
When do you know that it's time to replace that knee, and what exactly is that process like?
When we're talking about treating wear and tear osteoarthritis, it's important to categorize it into two separate categories. The first category is the management of osteoarthritis, which is the strategies that we try to modify and manage the symptoms of the arthritis by non-surgical methods. And that could include anything from activity modification, anti-inflammatory medications, in certain cases bracing or injections. And then the second category of treatment for wear and tear osteoarthritis is the cure, which is knee replacement surgery. And we only consider knee replacement surgery when all of the strategies of modifying and managing the symptoms have failed.
So that's the last resort.
It is.
What is the recovery time like on something like that? Does it depend on your age, or what is the recovery time for that?
There are a number of factors that affect that, and everybody's ability to bounce back from a knee replacement surgery is unique. But in general terms, it does require a hospital stay, either 2 or 3 nights in the hospital, up and walking on the new knee within 24 hours after surgery, typically off any kind of walking devices such as a walker, cane, or crutch within 6 weeks. And for most people, back to full activity somewhere between 2 to 6 months.
About 10 seconds here, but most of them are very successful anymore.
And getting better all the time with improvement in technologies and materials.
Doctor, thank you so much for joining us. I know this is an issue that a lot of people want to address, including myself, in that age group. We appreciate you being with us.
Thank you.
Have a good weekend.
You too.
For more information on knee replacement surgery, check out our website for links at KFOR.com/links.